What does it take to become a doctor? These are the real-life stories of McMaster University's med students. On this episode of Med Students, Monali spends a long night alone in the intensive care unit. Karen learns to walk the walk and talk the talk. And Jen endures a grueling exam.
That one sucked. Ugh.
Carol, hi there. I'm Dr. Misra. I'm one of the residents who's working here to look after you as well. I just wanted to fiddle around with this just to see what's happening with your heart, how it's pumping, okay? It's just one of the lines.
Dr. Monali Misra is a third-year resident training to become a general surgeon. But today, she's working in the intensive care unit. Monali is new to ICU. In a few hours, her supervisor will leave for the night, and Monali will be responsible for the hospital's sickest patients.
Something goes wrong, they only have me. That's the only part that's the most stressful. Like, nobody's in-house, so for someone else to come in, it would take them about 20 minutes, so I have to be able to keep them alive for over 20 minutes.
Just wiggle this leg.
Overnight, I just sort of continue to be stressed. There's nothing you can really do. I mean, you try and relax. My sister lives close by, so I go and visit her whenever I can. The rest of my family's far away in Saskatoon.
Monali is paged to see a patient who needs heart surgery.
This patient that's coming in sounds pretty scary. She's just very unstable, unfortunately. I mean, when they come post-operatively, usually you know that their heart's all fixed up pretty much, and you just have to deal with them. But when they haven't had any surgery for her heart is obviously crap. So these are the stressful ones, because they can crash at any time. They're obviously doing so badly that it's a little more urgent. So I guess we'll see what happens.
You gonna wake up now? Mom's gotta get going. You gonna give me a kiss? Okay.
Oh, boy.
All right. You wake up, Dad, when you get up.
Okay.
It's early morning, and Karen Hill prepares for a long day. Today, she begins clerkship. Over the next 18 months, Karen will spend less time in the library and more time in the hospital, learning from doctors on the job.
No, I'm just dreading the schedule.
Her schedule will now include 26-hour on-call shifts. It will be especially tough for Karen, who is also raising two sons.
I got a new car because my son drove my other car into a tree, and so it is no more. How's Christian been doing at school? He doesn't like the school at all. He hasn't liked it since the day we moved to Hamilton.
Christian is running into trouble in his new school. And Karen's not happy with the way things are going.
She says to me, obviously there's serious problems at home, right? That's the first thing she said to me. She sees a Native woman in front of her, and her assumptions probably run along those same lines, you know? Oh yeah, she's probably a single parent, she probably, you know, whatever. I said, I'm not here to accept blame or to lay blame. I'm here to hopefully find solutions to help Christian to adjust. I'm at my wit's end. I'm just figuring, you know, I'm gonna be a bitch.
So once again, welcome to the pediatric clerkship.
For now, family problems are put aside.
While these patients are complex,
Karen begins her clerkship with an intense 4-week rotation in pediatrics. Monali reviews the heart patient's chart.
How bad was her MI?
So she's had a severe MI. EKGs are showing sort of gross ischemia.
Great. Oh my God.
When they said diffuse ischemia, they weren't kidding. Wow.
Holy cow. I'm Dr. Misra. Hi. I'm one of the residents working here as well. I just need to put in a line into your wrist here, just so we can keep a good eye on your blood pressure constantly instead of just taking it with the cuff all the time. Okay. And also, they don't need to keep poking you every time they need blood work on you, okay? Yeah. Oh, great.
That's part I like.
Okay, yeah, I thought you would. Little poke. That's it. You all right? Okay. That should be the worst of it. Hopefully. Sometimes it works, sometimes it doesn't.
Oh, are you in there?
Yeah.
I just moved. Perfect.
Thanks. Good timing.
All right.
I think that's round starting soon.
Karen and the other new clerks meet Dr. Caroline Ernst to find out what is expected of them on the unit.
She's reviewing things. I know this is their pretty much your first day of clerkship, right? So we'll be doing really rudimentary things. So you can each take 15 patients, right? Is that okay? And we'll get you down in ICU next week.
It will be a long time before Karen can handle 15 patients. She first needs to learn the basics.
What are those differences that are going to make things different? Like, how are the lungs different, and how is that going to function? You know, how is that going to affect if they have an infection, or if they're on, having to get oxygen or whatever. So that's what I want to get a really good feeling of is normal physiology.
A new patient arrives who has just had brain surgery. Monali is concerned her blood pressure may be too low.
It's exciting, but stressful, so I think my blood pressure is probably higher than hers. So. Yeah? Great. Thank you.
But before she treats the patient, Monali consults her neurosurgeon.
Hello? Hi, Dr. de Villiers. I'm one of the ICU South residents. I just wanted to, the lady that we just brought in right now, what range did you want her blood pressure at? It's sitting around 110, 120. Did you want it higher than that? So this is like my first day on call here, so that's why I don't know where exactly the surgeons want the pressures to be, and so I need to make sure with them I don't want to just guess and do whatever I want to do, because you may get mad. So, do you want me to go check? What's her mean pressure? What's her mean pressure?
Her mean pressure is 85.
It's 85. Okay, thank you. Yeah, bye-bye.
Monali's patient is medicated to try to improve her blood pressure.
We never use these drugs. I've never used these drugs usually until I've been in the ICU. So I just wanted to make sure the concentration was right, which is why I'm looking at my books. So I'll give her 250 of 5% albumin as well. Okay.
I'm Jen Robinson, and I'm a first-year medical student at McMaster. I've wanted to be involved in medicine, I think, as long as I can remember. I'm interested in a lot of different types of surgeries. I definitely want surgery. I think I've always been just interested in technical things in general. Track and field, for instance. I was a hurdler, one of the most technical sports.
Although Jen loves the technical aspects of surgery, she must also be able to relate to patients. And today, she faces a grueling med school milestone.
So, are you guys as nervous as I am?
Over the next 2 hours, Jen will meet 10 actors posing as patients.
I have no idea what to expect.
She'll have 10 minutes to come up with a diagnosis. She'll be graded on her ability to uncover hidden clues and how well she interacts with patients.
My name's Jen. How are you? I'm a first-year medical student here. I'm going to be talking to you today about why you're here. So I understand that you've had a bit of a cough and some problems breathing. Do you want to tell me a little bit more about it?
It's basically just I have kind of a cough and I feel short of breath.
Okay. Do you have any pets by any chance?
No,
Do you have any allergies?
I don't think so.
Okay.
Jen has 30 seconds to go.
And you don't work, where would you work in the summer?
I work at my cousin's store. It's a pet shop.
Okay. What kind of pets would there be in there?
All kinds, fish, rabbits.
Bingo. The key to this patient's illness is an allergy to rabbits.
Yeah, I covered almost all of it. I'm not sure if you asked her about having a history of asthma herself. I don't think you asked
I didn't ask her
Yeah.
exactly, no.
Overall, pretty good.
It's the buzzer.
Right.
Thanks a lot.
Okay.
That one went well.
Hi, Ryan.
Hi.
My name is Karen.
Hello.
And I'm a medical student.
Yeah.
And
Karen's first patient is 9-year-old Ryan. He has an eye infection.
so just for now, I just wanted to know if you could just tell me about what happened.
One day it just popped up.
One day, how long ago?
I just had to see around Christmas Day.
Was it itchy or
It started being irritated a bit.
did it?
Yep.
Okay. So they got you back in here on some medicine there, I see.
Yeah.
How are you feeling? Do you think it's getting better?
Yeah.
Yeah. Okay. How is it getting better? What's changed?
It's the swelling has gone down. The redness is starting to fade away.
Okay. Let me know if there's any questions that you have or anything like that. I don't know if I'll have the answers, but if I don't, I can certainly find them out for you.
See you.
Monali's brain surgery patient continues to be unstable and needs to go back on a breathing machine.
He suggested we re-intubate her, gently hyperventilate her overnight, and start her on some mannitol.
Let me give you a little spray. Open up your mouth for me. Just open it up. Open up wide.
ICU physician Dr. Cindy Hemlick supervises as Monali attempts to re-intubate.
Doesn't taste very good, does it? I know. I'm sorry. I can't even see her cords.
Okay, so take it right deep to the back and just lift. Okay.
It's barely.
Okay, I'll trade places with you.
The patient's narrow airway proves to be too difficult for Monali.
Really tight. What size tube have we got?
It's an 8.
Don't feel bad about not getting that. She's really tiny. That was a hard one, yeah. Okay, so are you happy with the plan
Yeah.
for then? Okay, and I'm only 10 minutes away, so if you need me, don't
Great.
hesitate.
Thank you
Okay.
so much. Okay.
It's now 10 p.m. Time for Dr. Hemlick to leave for the night. For the next 9 hours, 26-year-old Monali is the senior physician in the ICU.
I think they're trying to hide us somewhere in the basement dungeon.
Monali has been working for 17 hours and is on call for another 9. The ICU is quiet. Time to grab some sleep. But first, Monali has to study.
Got a lot to read, lots of studying to do. We have an exam coming up next week, so hopefully I'll get through some of this because I know tomorrow's going to be shot. I find I'm still sort of stressed because patients are so sick and you never know what they're going to call you for. They can call me for anything.
It's not too long before Monali is called back to the ICU.
Ron, are you having chest pain? Are you having pain?
A patient's heart is racing out of control. He may be having a heart attack.
His heart rate is way too high. His heart's not going to be able to tolerate it. It's not going to be able to pump out the blood as as much as fast as he needs. But the drugs we've given him so far aren't slowing down his heart rate yet. So I'm thinking I need to give him more. Hopefully we can get this under control.
That one didn't go so well.
After a great start, Jen is having problems.
Okay, well, I've come in because I've got a cough. And it seems to have got worse in the last few weeks.
How long have you had the cough for?
Well, I've had a smoker's cough for years, and I'm used to having that. Well, I know what it's like, and this is different.
So you're a smoker?
I'm a smoker.
Yep. How long have you smoked for?
Oh, I'm embarrassed. Years. Yeah, since I was a teenager.
Do you have a history at all in your family, parents or anything like that, with any respiratory problems or cancer?
Nope, not that I know of.
Nothing like
No.
that? Okay.
Do you think it could be cancer? Is that what you think?
I'm not quite sure yet. I'm just going to try and talk this out while I'm talking to you. I'm not going to say anything until we're done.
Time is ticking away on this case.
Oh, I should have mentioned I've lost a little bit of weight.
Okay.
About 5 or 6 pounds.
How much weight have you lost? Oh, you just said that.
Yeah.
I was thinking ahead of myself.
But you were nervous.
And now a review from the actor.
I thought you were nervous just because there were long gaps.
Oh, okay.
But you were
Interesting.
very nice. I had really good eye contact. And you made me feel comfortable, which is good.
Okay, thanks. I just don't have much time to read. That one sucked. Ugh.
While Jen learns to speak to patients, Karen learns to speak to doctors. She presents her patient's case on rounds.
36 kilograms. He's here with a diagnosis of dacrocystitis, admitted January 5th. And I guess there's a question that he was on antibiotics and his previous admission left and then it flared up again. So my question is it a safe period of time to put him on an oral antibiotic and then reassess tomorrow for him to go home?
Okay, good. And he's getting better or worse?
He's getting better.
Okay, just say hi to him later on, okay?
Okay.
Okay, good. Let's carry on.
Today has been information overload, lots of information, but good. I get a good feeling of what's expected, and that's the most important thing, that I know when I come back here tomorrow what's expected of me.
Monali stands by as her patient's heart continues to race.
The drug that we're using to slow down his heart rate, it takes a long time for it to actually work on him. Like, it's taking longer than what he's not going to be able to tolerate his heart rate that fast for that long. So I'm going to give him something else to add on to that. I just don't want them both to make his heart rate really suppressed.
And now the medication is causing his blood pressure to drop.
Oh boy, his blood pressure's dropping. So we're just going to give him more of the drug that we were just giving him and see if that helps.
You want another
Karen's new schedule makes it hard to find family time. Today, she puts her homework on hold for Sunday dinner.
Mom's here. Sometimes I get stressed.
But not today.
No, not today. It's Sunday. What did I learn from my mom? I learned a lot. I learned to cook, but I purposely forgot that one.
God is grace, God is good, let us thank him for this food in Jesus' name, amen. Remember before when I used to go, let us spank him? That was when I was little.
Let us spank him.
Family is important to Karen, and so is fulfilling her dreams no matter what.
This is my grandfather when he was very young.
And that's what they used to do for a living, was cut wood. because, like I say, my dad couldn't read or write. And this is a tar paper shack that we lived in the middle of the bush. That's how I was raised up till I was about 9 years old, in the bush.
You can kind of get past a lot of the obstacles that you think are out there. You know, that most of the obstacles that are out there are in your mind, they're in your thinking. You know, and thinking that, okay, I'm poor, I've always been poor, my family's poor, nobody's educated. You know, all of those things are barriers, but they're barriers here.
Jen's exam is coming to an end. One more patient to go.
Do you have high cholesterol? You do? Okay. And do you have high blood pressure? You do have all those? Okay. I think I'm going to leave it at that.
Do you think you've been able to kind of deal with her concerns?
No. I think I've neglected that a bit. I don't think it went so well. I really thought I knew my stuff better than I performed, so. But overall, it's a great learning experience. I mean, I definitely won't forget the things that I did badly.
We're winning.
Monali's patient is improving.
It's coming down now. It was in the 160s and stuff. Now it's 130, so. He's pretty much settled. He seems okay. I'm relieved. Great. Oh, that looks good. Thanks.
And after a 26-hour shift, Monali can leave the ICU. Her next rotation will take her back to general surgery.
Oh, God, it's all I want to do. I miss it when I'm away from it. A lot of people think that I'm crazy because, you know, your lifestyle sucks and your hours are awful even when you're done. But, you know, it's worth it if you like what you're doing, and it still excites me. So even though, you know, we've put in a lot of hours and it's a lot of hard work, but it's worth it.
On the next episode of Med Students, Karen is called to the ER. Allison has her final residency interview. And Sarah works with the anesthesia team.
The first operation that we're going to be participating in tonight is an amputation.